as you can see from the skit, a yeast infection is a type of Candidiasis fungal infection. So what is it? It's an opportunistic fungal infection, which means that it's an infection that takes advantage of certain situations. An example of an opportunistic situation would be a compromised immune system. Any Candid species can cause an infection. Candid species harbor 40% to 80% of healthy individuals' digestive tracts. Where does it manifest? It has a wide range of manifestation areas. It can be oral in the mouth. You can have diaper rash, nails, ocular. Also, the most common yeast infection is in the female reproductive system. Different rates of manifestations. Orally, healthy individuals, you will find it very rare. Newborns, 5%, elderly, 10%. AIDS patients which have a compromised immune system, you will see it very often. What are the ranges of these types of infections? You have superficial, which are found in skin and mucous membranes. They can cause local inflammation and discomfort. Some examples: oral thrush, and of course yeast infection, which was part of our video presentation. Systemic is another range of this infection, usually confined to individuals with severe immune compromised systems. Cancer, transplant, or even AIDS patients. These can be potentially life-threatening. A superficial infection can enter the bloodstream and it can develop into a systemic infection. What are the signs and symptoms of these infections? They will vary depending on the area that's being affected. Most of them have minimal complications like redness, itching, discomfort. However, some symptoms that are left untreated can become very fatal. What effect does the immune system have on the infection? Localized infections, oral cavity, pharynx, esophagus, urinary bladder, those are some of the localized infective areas. Individuals with a compromised immune system, they have esophaguses. Their esophagus will have the potential to become systemic. About 15% of individuals with weak immune systems develop a systemic illness. What causes the infection? For example, from our video, yeast infection. What caused it? There can be several things that could have caused it. External use of detergents, internal disturbance, hormones, physiological disturbances, normal flora of the area have been upset, so it leads to overgrowth of the yeast. Other risk factors: pregnancy, diabetes, antibiotics, diets high in carbohydrates, and wearing moist clothing for long periods of time. All of these are factors that can lead to this type of infection. So how do we treat it? You have antifungal drugs, which are called antimycotics. You have oral treatments, and you can also have different ointments to treat the different types of yeast infection. Other diseases that are linked to this: AIDS, mono, cancer treatments, steroids, stress, and nutrient deficiencies. All of those can be linked to a Candidiasis. I shouldn't have. You just cut it off right.